Hey, welcome everybody to the Designing Wearables for Health panel and fireside chat. We have amazing speakers and panelists here today with us. We have Krista Jäntti, who is the lead designer at Reaktor. And then also we have Niina Venho from Moodmetric, who's the CEO and founder. And she's just, yes, exactly. So she's setting up some gear and gadgets for us. So basically, if I understood right, Niina and Krista are now wearing these rings designed in collaboration with Kalevala Koru and Moodmetric. And I'm also wearing one, but mine doesn't work. So I think it's good that you maybe don't see my stress levels now. So there are screens, and you can see your stress levels now on those, right?
That's now Krista, sorry.
Okay.
Okay.
So, yeah.
She was so calm in the beginning that it was safest to put her figures. I'm at 46 at the moment.
I don't know how much it shows at the moment, but it's better that I don't see my own.
You don't get stressed of your own. Yeah. So I will quickly tell a bit more. So Niina Venho has a past in the electronic contract manufacturing, and she has been working in the electronics project and operation management for more than 10 years. And now, so Moodmetric, in that company that she's currently working and has founded, that they are developing these easy-to-use technologies for services to manage stress levels and recovery management. And now it's in a form of ring. And so that's their current product. And she's really excited about this kind of new innovations and startup culture, which are improving the healthcare currently.
And Femtech.
And Femtech, of course. And then also, so Krista has a massive, 13 years experience from the consulting business in digital user interfaces and also from the design background. And she has been working in companies like Kone and LähiTapiola, and currently she's the lead designer at Reaktor. And she also supports startups in the Reaktor Ventures part from the design perspective. And also she has very keen interest on the Femtech, and she would like to see more women in this field. And yes. Now when I got inspired when Anna mentioned her mentor, and I don't know, is Minna still here? She was. Okay, too bad. Okay, but she used to be my boss before, so also she's one of my sources of inspiration and kind of how my career path started developing. So it's been great to have these role models, as were discussed in the previous panel. Okay, so let's go to the questions. And yeah, quick intro that I'm director of HealthSPA, so the Health Startup Association of Finland, and we have been behind this event, and it's now coming back for the 4th time. And my background is from Tekes, and now I've been a few years working with the health startups at HealthSPA, supporting them and the ecosystem building. Okay, so maybe quick question for the audience before I start asking you that how many of you own some kind of wearable? Raise your hand up. Okay, so quite a lot of you. And I guess, so at least I know that Krista has a lot of different wearables we were discussing before, and for sure Niina too. But I think one of the questions we could start with is that we have seen so much wearables coming up, but is it really still a trend, or are we seeing that it's started to go down? And do people still find a meaningful use for it? And yeah, how would you can start, Krista, if you wish.
Okay, it's a trend and it's still going strong, and I'd say we are still sort of beta testers going on, so we are not even going. We still are going to have more and more wearables. Actually, there are coming new every day. I even cannot follow which one are coming. There are coming so many different kinds of wearables. So yes, we are still kind of research phase, and more are coming. And the trend is that there are going to be a lot of interesting wearables to come.
Yeah, I think there's been some discussion that are they already passé, the wearables, that okay, be they done that and activity trackers checked. But if we look at the numbers and growth curves in wearables industry, yeah, it's still growing, and I think variety is getting bigger and quality is getting better. At least those ones that are not performing well and not tracking well, they will be dropping out very fast because consumers are getting more and more aware of what the wearables could give them and what is this one now that I bought. So it's a growing trend.
Okay, good. Thank you. And then I could continue this, that when it comes to the data, so what we are tracking a lot of different variables with different kind of wearables, and many times people discuss about the reliability, like, okay, is this really, like, I get the numbers, but is it really is it truth that my heart rate is so on and so on? So do you have, like, what wearables and what kind of numbers are now reliable, are the most reliable currently? Do you have, like, what's your opinion on that? That what can we now currently reliably track?
So well, I'm not a researcher on the area, so I cannot speak from that perspective, but what I read and what I know is that, for instance, heart rate and heart rate variability is best measured from your chest still. If you want to get a really accurate reading, it has to be done from the chest. Although the optical measurements are developing and getting better also from the wrist and other parts of the body. If you want to know something about your brain, it's the MRI scans and so forth. They are the most reliable ones to get info, also although very expensive way to get information of your brain. So those wearables that are developing, they are still, I would say, in a stage of development. The electrodermal activity signal that we are measuring, it's best done from the palm of fingers. So basically for all the measurements, there is one way to get it quite well from your body. And there are trackers that measure like 50 different things. It's obvious that not all the measurements then are accurate.
Yeah, the question you asked made me a little bit smile, because it's still kind of you get to know your body and how do you react, and do you find any correlations between your feelings and your data. But of course you don't know the algorithms behind the apps. So yeah, if you want to be like a real researcher, then you go and search the papers about it. But I guess the consumers, they kind of want to know how you feel your body, and does the data show that, for example, I cried in the movies? So there are like medical who wants to be really accurate, that is this data like very consistent and things like that. But the people who bought those wearables, they might not be that, I don't know, that it has to be like 100%. I'm not sure that do we get there. Maybe we do get there finally, but there are different gadgets, and if I compare those results, there are differences. So
yeah, and indeed, I guess that's one of the challenges for the consumers, that they have, indeed, if they have same different gadgets measuring the same thing, but they give different numbers, how can you know which one is right? And even if you have one, like, yeah, indeed, that I guess it's really hard for the consumer to actually understand how much they can trust.
The crash there, so huge peak, because I was afraid somebody's attacking us.
Yeah, you can now follow indeed, like, when Krista is speaking, if there is change in the stress levels, and yeah, exactly. Okay, so when then let's talk about the challenges. Like, what are the biggest challenges for the wearables currently? What is needed to take them to the next level, and what are the possible barriers? Is it the size? Is it the technology? Is it the users that they just, and the user interface and everything? Or yeah.
Yeah, I find it very, very bad design at the moment, that if you buy different kind of wearables, you have to have an app for every different kind of wearables. So they're still missing a good platforms where you can combine all the different data coming from different kind of wearables. So they are designed like, I have only one, but well, I'm interested in many wearables, so I'm wearing many of them. So I have to go through the data for daily, like syncing this one and then going to a different app and syncing that one. And of course, the charging is still a big issue, that you have to charge some even every day, some like after 5 or different days. So the charging process actually makes the wearable a little bit more difficult, because you tend to forget to charge them. And as I did today, I forgot my wearable ring to the charger. I never even took it when I left my home.
I think I agree. So battery lifetime certainly is a challenge for consumer as well as the multiple apps. Then, of course, the design, how they look like, it comes up always. People would like everything to be more beautiful, lighter, as small as possible, and then give all the data. And currently, it's not yet possible. There has to be some device, and you have to wear it somewhere. But obviously, things will become more consumer friendly. And I think one thing that whatever you wear, it should be very nice to hold. So it shouldn't leave any traces. It has to be so tight or anything. Then the developer has gone the wrong way. So I think the visual aspect will also be a big thing and awaited in the future. And not just a huge clump with some digital numbers running down. So I think a lot of engineering groups, mainly men, have designed the first wearables. So I think women will bring a lot more attractive things to the audience in the future.
Yeah, if you talk about the first phase of wearables, they were like big, bulky wristbands. And many women cannot identify themselves with wearing like this side of wristbands.
Yeah, indeed. So if you will now take the female aspect, indeed, that have you seen a change in that? And kind of, yeah, I guess that this also has been very male dominant area to design these wearables. But do you see a change in that? And where do you think it will lead us to? And will we have more beautiful things because there's more females, or is it just better design constantly? Or
yeah, I definitely have seen a change. Now wearables are coming. They start to look like things you would wear in your everyday life. Like if you have a smart belt, but it still looks like a normal belt, or you have smart sneakers, they look like normal sneakers. So we have become to the phase that design has an important role, that if the consumer wants to buy that product or not. And I think the next phase, that the wearables are going to be even more invisible, like ingestible wearable, or patches where you hide, or even invasive wearables.
I think a lot will change, and partly is that design is getting better. So startups developing a device are contacting designers to make them look nice from the start, and they can be both men and women, but I think women are bringing many more aspects, like what they would like to know, like the period tracking. It's not probable, or it would have not been possible, the first clumpy trackers, to have period tracking somehow included in them, because it just didn't cross the mind of the first developers. So I think diversity and variability will be there, partly because of women, but of course everything is nicer nowadays. If you look at any website, if it doesn't look good, you just browse away. It goes with the devices as well. It has to be nice looking and nice feeling. And also the data and information, it has to be such that it's interesting. Like if you have a huge amount of graphs that you don't understand anything about, you can simply leave the tracker. Because before you felt that I have to understand all this, and went through the data and went through the graphs, but now I think people are more impatient in a good way, and they want things to be simple and understandable. So also this aspect will be stronger.
Good, thank you. And yeah, so basically we met with Krista and Niina last week and just discussed a bit about a panel. And Krista was mentioning some of the wearables that she was wearing, that I think you have been testing like everything you have found on the wearable sector. And I heard you had some rings coming up.
Yeah.
So what has been the craziest thing that you have been trying, or the most impressive one? Maybe if you can maybe both mention.
I haven't been able to test the crazy ones, but of course very interesting is to have the accelerometer chip inside your tooth. It's still in the research phase, but it's very interesting because they can very easily separate between your eating habits, your drinking habits, your smoking habits. That's kind of getting very interesting data about yourself. And the craziest one I think is at the moment wearable where you train pelvic muscle floor. And they have gamified it. So if you squeeze, it makes a butterfly fly a little bit higher or a bird flying a little bit higher. So I think that's a good way to go, to a little bit gamifying and making it more fun.
Do you have, Niina, some other examples you want to share? Or
no, I haven't tried myself, but of course, like the things that you eat your yogurt and it has things inside that will analyze things going through your system. And then the color of the product will tell which diseases you might or might not have. It's really interesting, and those are really not disturbing you at all. You simply eat the yogurt. So waiting for that.
Sounds good. Let's see what the future brings to us. So we have seen a lot of wearables in different parts of the body, like indeed like a ring, a wristband, necklace, earrings, now tooth even. Do you see, is there going to be a change on the, like now the wristband is clearly the most common one, I would say. That do you think that's going to change, or is this already the dominant place for the wearables?
I don't know how many of you listened to Teemu Arina yesterday, but he told about, well, I'm not sure if he told about yesterday, but the trend it might be getting that the wearables are going to be maybe in near future inside our body. So I believe a little bit into that trend. It's if they're going to have like big needles, where at the moment if you want to have the chip inside your body, it's actually quite painful. I wouldn't do that. But if they are going to be more like those ingestible wearables like Proteus, or things like don't have the pain if you put it. So I think the data will become more accurate if you go a little bit inside, and then of course the different kind of tech tattoos, they might be coming trendy, or sort of black patches where you just hide it or somewhere there. So yeah, I think things will stay like rings and necklace because they look nice. They are like bringing a little bit spice. They have the data and a little bit you can get to know something about yourself, but they actually look quite nice. So I could wear this anyway, even though it wouldn't have the data aspect.
I totally agree with this, and as we are now collaborating with Kalevala Jewelry, who have been making jewelry for 80 years, we've been discussing a lot about this meaning about jewelry and so forth. Like people have been wearing jewelry for thousands of years, and they always had a meaning. They were amulets bringing you luck, happiness, and love, and they really always had a meaning. So I think smart jewelry is bringing intelligence and meaning back to necklaces, earrings, and all that we are wearing anyway. So I think one way can be things that are invisible or they're inside of you, but then the jewelry that you wear anyway, why wouldn't all of your wristbands that are jewelry have some intelligence? All the rings and earrings. I think when you go to a jewelry shop in 10 years, you can ask that, okay, does this have this activity tracking inside and that has the Moodmetric inside? I would take that one with that one inside. No, I want combination of those. So I think this will be really, very, very soon it will be the way that you can just pick and choose what is the intelligence inside the stuff that you would have. Like Google Glass is one example, but I don't know if it's the best one. So things that you would wear anyway.
Like, sorry, I just want to add that I guess the smart glasses are coming bad, but they start to look more like normal glasses. They just are going to have also a little bit smart wisdom.
Indeed, and I guess this might be one of the solutions for the use of the wearables, because I think many people, they use it for a couple of weeks, maybe some months, and then it's just stored in some closet in the home. And at least that has happened to me sometimes. Like I get first very excited about the data, then I have the data after a few months, and then I think like, okay, I kind of understand my body now on this metric, and then I just leave it and don't use it. So when it's kind of embedded and you would anyway use it even without the tracking abilities, I think then indeed that this is one of the keys. And then, and actually this also probably, do you think that this way we can also attract much more users, or I guess this is one of the solutions to get it more even mainstream? It's becoming more and more common to have wearables, but kind of do you see what are the trends in this one, kind of the amount of users and the type of the users?
So I think the tracking that was not discussed was the tracking that you have on your phone. So there are hundreds of sensors in some phones, smartphones. So I think this has certainly brought new users to these services. Some of people don't even know what they can track already, like the steps. Each smartphone has a step tracker, I think. So there are trackings that you don't have to put on or wear in any special way because you are doing that anyway. And your cars, they have tracking. Probably they will have some physics tracking in the future just automatically. So for sure, I think millions of users are coming to get to know the sensors in very convenient way. You don't have to do anything extra.
What I would like to add that there is always people who are not very interested about their health. So even though the wearables are coming more and more, the fact is that the people who would probably benefit of wearing those wearables most are not using them. So there is a challenge that to get it's not only wearables, it's a challenge to get people interested about their health and how their choices are affecting their body and things like that. But the fact is we cannot get everyone to be interested about their health.
I think that was that's a great point. And I think device manufacturers, like ourselves, we don't just want to sell devices, we want to make changes in people's lives. And for instance, we want to help people to avoid burnout. It's simple as that. So there is a meaning, and we see people who we think that would greatly benefit of our product. But we need to get it in such an attractive package that they would buy it, even if they are a little bit skeptical, and even if they I'm not stressed, and still try and use it for some while and get the help. And like maintaining healthy lifestyle, trackers can help. They are not best fit for everyone, but I think many people would benefit and kind of get a little bit upgraded life with very few simple steps.
Yeah, indeed, because when you discussed about health, that this would be the group benefiting the most, but it's kind of then sad that that they are so hard to reach, and maybe they sometimes just don't want to see the data. They might know that, okay, probably it wouldn't be nice, so I just kind of ignore it and that's it.
Hope the things are going.
Yeah, exactly. Maybe this time we have a couple of minutes left. Is there some questions from the audience that you would like to ask from our panelists? Be brave. Yeah, there's one.
Yeah, thanks.
Hello. Thank you for an interesting discussion. So you touched a little bit upon just now on what to do then when you get lots of data, what to do about it. So one topic is habit formation or getting rid of bad habits. So I'm wondering, what are your learnings so far on the next steps on after you give awareness to the user through data? What kind of nudges, what kind of guidance can you give to the user to help them then build new habits or get rid of bad ones?
I don't need a mic. The problem is that the data is really not enough to change your habits. You need a little bit more. And at the moment, there is not much more about in the apps. So people are like, really would like to have more coaching inside to the apps, telling that these are like bad habits. You should sleep more. Some do that, but it's not very interactive. So if you they have trying to put chatbots or voices that coach, but still they are not quite there to to change your habit and make it stick. That's one of the biggest problems. It's very difficult to do that. So I don't have the proper answer, but if you have a human between you and your data, that would bring more effect. It has shown that they do tend a little bit make your like activity trackers. They do have a little bit effect that people actually are starting to take more steps. But to have a long-term effect, it's quite still like a little bit, but not like that much you would suspect.
But it's a very good question, and that's people do ask that us a lot. First step is to have more guidance in the app itself, what you should do and what you shouldn't do. And artificial intelligence will help with that in the future. So it will check your patterns from the past, see how you're behaving, and then drawing conclusions of what you should do and what you should not. So that's individual. Because guidance that drink more water, that's quite easy to give. You can give that advice always, but that's not very personal. That might not help you at all. So it has to be coming from your own data, this advice. But then if we think that, for instance, in an organization, we would do a measurement for 100 people. And let's say 10% of them would be really needing help. Okay, they would need to be more physically active, or that's another group that would be really, really stressed. Plain guidance from the app might not be enough. So we are seeking partners and planning content to have, for instance, online help that will be with the coach, physical person at the other end, or firstly with the bot. But something that would bring you to the next level from the app if you really need help. And the final stage, of course, that you would have a person that you can go and meet if your life situation is very severe or difficult. I think in an ideal world, all the trackers would be on one platform, and there would be another platform that you can go to kind of a next level if you really want to transform things in your life. And there would be the medical side would be involved, and doctors would be interested in the data that you have collected and help you based on that data. We are not there yet. I think medical world is still quite much apart from the trackers. But later on, things will change, I believe that. And then everyone would get the help that they need and additional advice.
Yeah, I think this was a really conclusive answer. Or do you have something to add still, or was it?
Well, no.
Okay. Yeah, maybe we have time for one short question still.
Okay, wow. That was like three, so
Everybody got brave now.
is that okay if I could this? I can see that Finland is warming up in the questions now.
Thank you. I'm Tiina Leivo. My background is in medicine and business. I'm MD. I would like to ask, how big is the market? I mean, what part of population is using some kind of wearable? What is your estimate, for example, in Finland, or maybe US is also interesting to know.
Some exercise. Yeah, go ahead.
I would have to Google it, sorry.
So anywhere there are millions of users of some kind of tracker. And the market sizes are hundreds of billions of dollars for the wearable market as a whole. And the trend is growing. So not half of the population is using some kind of tracker, but maybe 10-20% of adult population certainly is having some kind of tracker, and that is growing, and many people have several. So that's not a small market, and I think one thing is that the accuracy. Some people are wearing whatever tracker, some people are very keen on having a specific and accurate tracker, and that's a good thing, and I think that will be growing. So when, I don't know, 30% of adult population have an accurate, good tracker, I think then that should be used for personalized, digitalized healthcare. And then there will be a lot more information and data about the people, and not just that how are you feeling, and okay, your blood test result shows this, I will prescribe you this medicine. So they will be valid and useful devices in the future.
Good, thank you. Did you have something to add still? Or?
No, it's also a question about where you draw a line, what's wearable and what's not. Yeah, everyone has a phone, and then there's a virtual reality like things, but most when they talk about wearables, they think about activity trackers, but there are so much more. But yeah, I think there is some numbers which I'd love to check, but $100 million value going on.
A big number.
Yeah, it's a big market for sure. Okay, yeah, I think we're running out of time. And yes, I would like to thank our panelists for this, and maybe you might catch them later on in the open space, and at least yeah, and actually if you want to check these out, there is Kalevala Jewelry and Moodmetric have a stand there, so if you want to test these rings, feel free to do so. And yeah, and I will pass it on to Anna.
Well, thank you on my behalf as well to everybody. Thank you to the audience. Thank you to the speakers. And this is the first time we are doing, as I mentioned before, this Women and Health Tech track. So please give feedback as well. It's very valuable for us. And maybe next year we do it even bigger and more. So please give feedback. What kind of sessions would you like to have? What kind of things you think that we should implement into the Women and Health Tech track? And enjoy. Today is not raining, so if you go outside, you can also enjoy a little bit today of the day, but stay inside, stay here with us at ULF. And if anything, so vertical, we are in A3. Come and talk to us. HealthSPA, you can find them running. And then Moodmetric, they are also like the stand number is
20 maybe, but in the middle.
In the middle. Yeah. It's in the middle. And Krista, I would just stay also with us a little bit, and you will be around.
Whole day.
Okay. Thank you very much. Let's give a big applause. And finally, thank you to my awesome colleagues, Dana and Heta. Thank you.